Hello, I am Dr. Nagaraj Puttaswamy. I am a laparoscopic surgeon and a bariatric surgeon at Punya Hospitals, Bangalore. So one should understand the process of a procedure related to hemorrhoids, that is piles what we call. There are multiple procedures which are associated with piles management. One of the procedure what we try to do is rubber banding. See, this is done with a simple instrumentation which is used to clamp the vein, and the rubber band is pushed on top of that to occlude the lumen of the vein, so that once the occlusion happens in the form of thrombosis, the distal part of the vein which is sucked into the tube which we use as an instrument is fallen off. So there what we try and do is we try to induce some amount of tissue necrosis related to the prolapsed veins which are there. We should also understand it is relatively complex for a common man to understand that there are multiple cushions of veins in the anal region, and if they become a little more bigger and if they start bleeding, we call them as hemorrhoids and associated bleeding. For that we try to do this stapler or hemorrhoidal banding or cryosurgery or cold laser. All these technical procedures are there. Any surgical procedure we perform, there is a tendency for the patient to develop some amount of pain following surgery and also some amount of bleeding following surgery. So if bleeding following application of rubber band after a few days, it's definitely been seen, and that happens only because the rubber band becomes loose and the tissue which is distal to the rubber band gets necrosed, and the whole tissue falls off and small amount of bleeding is expected to be there. If it is significant or alarming, it's better you see the surgeon who operated on, so that it is ideal for him to diagnose what is the reason for the bleeding.